Hello, we're Dr. Sandra Southard, Dr. Fern Webb, Dr. Juan Luque, and Dr. Lourdes Vazconde Garbonate, co-leads for the Community Outreach and Engagement Corps of the Florida, California Cancer Research, Education, and Engagement Health Equity Center. CARE 2 is a bicoastal cancer research and training center that brings together researchers from Florida A&M University, the University of Florida, and the University of Southern California.
The CARE 2 Health Equity Center is funded by the National Cancer Institute Center for Reducing Cancer Health Disparities. CARE 2 is committed to eliminating cancer health disparities and promoting health equity among Black, African American, and Hispano and Latino adults living in California and in Florida.
Our center focuses on 3 specific cancers: prostate cancer, pancreatic cancer, and lung cancer. We want to welcome you all who are listening to our We Care To podcast.
Now we would like to introduce you to our host for this first season, Pastor Rhonda Holbert. She's a breast cancer survivor and an advocate, and the founder and CEO of the Celebrate Life Cancer Ministry, which is a nonprofit multicultural organization available to anyone affected by cancer and their families. Pastor Rhonda also serves as one of our CARE 2 Community Advisory Board members.
Hello and welcome to We Care To podcast. I am Pastor Rhonda, founder of Celebrate Life Cancer Ministry, and your host for the podcast. Today we have with us Dr. Ebere Ume, and our conversation today will be around the intersection between mental health and cancer. Welcome, Dr. Ebere. How are you?
I'm great. Thank you, Pastor Rhonda.
Very good. I'm so happy to have you here. It's good when old friends can get together and just have a little chat. So if you could just start out by telling us a little bit about yourself and how mental health has been a part of your world.
Thank you. So actually, before I started cancer survivorship work, mental health was more of my background. I started as a registered nurse in a psych facility and then continued as I went into academic work. I started teaching mental health. So I've been in the mental health area for close to 20 something years. So that's my background. And then later I added cancer survivorship.
You know, we have all just recently come out of the pandemic. In fact, I heard someone say the other day, we're not out of it based on our mental health.
Mm-hmm.
And so when we think about just mental health in general, what are some common emotions or emotional reactions that go along with mental health?
Well, top of the list, of course, is anxiety. A lot of people, not just cancer survivors, but a lot of people are going through a lot of anxiety, depression, fear, being sick, catching something. And then, of course, since we're talking about cancer specifically, the anger about the diagnosis, the sadness, the uncertainty of what may happen to them are some of the major emotional reactions.
Wow. Yeah. As a cancer survivor, yeah, that truly rings a bell for me, because even when you think it's just one thing, so like I have a fear develops. It doesn't last long for me because I'm 23 years out now, but it still occurs. So when going to the doctor for that annual follow-up, I have that fear, that hesitational fear that I have to like deliberately knock it down, right? And then just really believe that all is going to be well when I get there. But I don't realize that anxiety, that fear is connected to so many other points. And as Americans, at least I know, is that we tend to use one word to explain everything.
Yeah.
And I think that a lot of people include mental health, and they're still on that old phrase where mental health meant being locked up in a facility.
In a facility, yes.
Can you help me unfold a package like that?
So actually, a lot of people are still trying to differentiate that the fact that when we talk about mental health, that we are truly talking about regular, sometimes extended emotions that most of us feel, and not just the extreme psychological issues like being psychotic, having schizophrenia or anything like that. But that some of the things that, especially in minority populations, that we don't consider or we don't want to put a label to. For example, people would rather say, I'm feeling blue rather than I'm depressed, because
Right.
it may be more acceptable to say you're feeling down or blue rather than admitting that I'm experiencing some depressive symptoms. So some of those issues that we need to be talking about openly, that it does affect people. Anxiety is another one that people may hide under the word worry. I'm worried about this. Instead of I'm anxious, I have this unsettling feeling about this process or this procedure or this news that I just received.
Is there anything we could do to get people to expand their vocabulary? And I guess I'm thinking about that from a standpoint of a counseling session, right? So again, I'm dealing with my own stuff right here. I've been to a counseling session for myself where I got away with using the big word and nobody caused me to break it down to really start getting to what's really going on, right? So is there something we could do even with ourselves, to be able to say what's wrong? Maybe that's it right there.
Truly, for me, it goes back to allowing people to feel comfortable expressing themselves without judgments or being quick to say, no, you're not depressed. No, so allowing people to feel that it's okay in certain quarters. I'll tell you this brief story. I have a conversation with my pastor, and I will say, oh, how are you, pastor? And he'll say, it is well. And I say, it is well the Christian way, or it is really well? He will laugh. He'll be like, Sister Ebere, what is the difference? I said, there's a whole lot of difference.
Yeah, a whole lot.
A whole lot of difference in allowing people, especially Christians and certain cultures, to be free, to feel that it's okay to say, I'm not feeling well today. And this is exactly how I'm feeling. I'm stressed, I'm worried, I'm afraid of this diagnosis and what may happen. Another fear is, am I going to die from this cancer? And most often we don't want to talk about that. People would rather you just not say it, okay? Claim it and believe it. But that's also a possibility. So allowing people to feel comfortable to speak their truth without feeling like someone will shut them down or will feel that they don't have faith enough. Just allowing people to be comfortable, so that they can be honest with us about what's going on.
Are there specific aspects of cancer-related stigmas that contribute to mental health challenges?
Well, the truth is, yes, there are some stigma in terms of people might be afraid to even talk to the cancer patient about the diagnosis, or the cancer patient may be afraid of not being accepted. Either people start walking on eggshells around that person, or not being willing to actually be honest that they too, as caregivers or as family members or as friends, may want to continue to engage, because in the past and to some extent now, that cancer diagnosis may ring to some people as a death toll, death penalty. So most people will withdraw and not be willing to engage in it with the person. But the truth is, those kinds of stigmas we can do away with public awareness, with telling people that most of these cancers, when they are discovered early and timely, are really treatable. You're a good example, 23 years survivorship. Awesome. And you had it in your 20s. You know, that must have been scary at that time. So just letting people know that if you feel something, check it out and not hide it, because that's another major issue we have in our communities of color, is that aspect of hiding the cancer diagnosis or being too afraid to even go check it out.
Even being afraid of a reoccurrence, somebody
Yeah,
who's already been through it. You
exactly.
know, I've known people to say, yeah, I know I had cancer before. I don't want to go through this again. I feel something, but I don't want to hear what the doctor has to say because I really don't want to go through that chemo again. I really don't want to go through that radiation again. I don't want to go through that regimen of what I had to go through again.
Mhm.
And that fear will stop you. It will slow you down rather than, in fact, my prayer has changed. This is probably one of the shortest prayers that I have, is find it and fix it, Lord.
Yes, yes, yes.
You know, because
Amen
if
to
you
that. I
find
need
it
to
and fix
fix
it. I
it.
don't care. I can't think about and fathom what it is, but if you could just find it and fix it, let them find it, let them fix it, right?
Yes.
That's almost shorter than Jesus wept, right?
very, very short. It's long. It's
Oh,
longer by 2 words. Find it.
okay. So,
But
yeah,
truly, that fear of cancer recurrence, it can stop people, but it can also make some patients become very hypervigilant and just into their health. They are very scared, so the anxiety topples and they check out everything, everybody's sensation, every symptom that they feel throws them into a panic. Is it recurring? Is it coming back? Those kinds of things. So, and brings back what maybe in military format we might call the PTSD of that whole experience, like you're describing. So it's either that in some people it really shuts them up, and in some people we might push them to overly, be so engaged with checking every little thing out, which is good. It's to some extent we want the balance.
right. The balance is real important because, so because there was a point where my oncologist had to say, Rhonda, everything is not cancer. Go to your general practitioner, right?
Exactly.
but we need people to understand though that the fear of a cancer reoccurrence is real
Mm-hmm.
and it's common. So don't beat yourself up with that mental thought, because we're talking about mental health, right? Mental health, mental wellness, right? So don't beat yourself up with that mental thought of why am I so scared of this? Why am I fearful of this? Why am I don't go there. Let's just process the part and move on to the next section.
And for some
So
people, it
go ahead.
also makes them withdraw, isolate themselves, because they may feel that, oh, especially you mentioned COVID earlier. A lot of cancer survivors that I knew became highly isolative to
Mhm.
themselves because of fear of getting sick, and that if they actually get something, which is realistic, that yes, immune systems have been tampered with, And so they may withdraw from social engagements, from family, from friends, which increases or impacts that anxiety and depression more.
Exactly. So, are there effective ways for healthcare providers to address and support patients dealing with this fear?
Yeah, actually, being open and having honest conversations with the patients and their caregivers is really critical so that they're able to speak their fear and get those fears allayed by a professional is key. Education and reassurance is also another major thing. Having to teach them about the cancer, the particular cancer that they have, so they understand what is going on in their body and they understand the medications or the treatment and what to expect. So they're able to report any side effects that they notice. The other thing is having survivorship care plans so that it's one-on-one, it's specific to that individual with their specific issue that's going on. And within the survivorship care plan, we make sure that they actually note who are their support people, who should also know about their care and what to do in case of an emergency. Making sure we provide them the psychosocial support. That could be in terms of referring them to counselors or therapists so that we're doing a holistic approach to care, not just, in terms of giving them chemotherapy or other treatments, but making sure that we also provide those kinds of psychosocial support, teaching them mindfulness, exercises, relaxation, which you're very good at with all the previous conferences and programs that we've done together. And just being there to listen, empathetic listening, hearing them out, trying to have collaboration and shared decision making so they are part of their care planning, they're part of their own care. I think these things are helpful.
Exactly, because it's, we talk about continuum of care. We talk about wraparound services. And
Yeah.
I really like to think about, especially in the area of mental health, where we're dealing with a person who feels like they're involved, like you were saying, that people have their arms around them and they're not just a cookie cutter. Here comes another patient. All right, what can we do for them and get them out the door? Even when a doctor can just sit down and look in your eye and let you feel seen, right? That can be the whole world of their care,
Yes.
because they have to be able to trust the doctor
Mhm.
or the health professional. It's not always just a doctor, the health professional.
Mhm.
Because as we go through the journey, there are some people that we end up connecting with, and some people we never want to see again.
Yes, yes.
And it's the desire that the ones we never want to see again, we don't have to see that often,
Yeah.
right? But it even brings me to a place of wanting to ask whoever's in charge, if you know this person is doing this to the patients, remember that the patients are going through a whole lot,
Yes.
physically, mentally, financially. There's a lot that goes, as a patient, where we stand, where the people that are there are just working. In many cases, they're just working.
Yeah.
But we want them to be aware that their responses, whether it's the health professional, whether it's the receptionist, whether it's a family member, we need them to understand that how they respond also affects the patient.
Exactly.
Because,
Exactly.
many of the patients are going through medications that are totally foreign to their body.
Yes. Yes.
And the medicine alone will affect your mental wellness.
Mhm. So as my sister described it to me once, sometimes the side effects of the medication might actually feel worse than the cancer.
Yep.
So
I can agree with that.
yeah, so that's
Sure.
a major concern. Yeah.
So, what advice do you have for caregivers in supporting the mental health, or, and I'll even say slash, mental wellness needs of their loved one?
Yeah. One major one is to just listen. Listen with empathy, listen with compassion, and not to be quick to dismiss their concerns. As unrealistic as it may seem to someone who's well, that, oh, you're worrying too much, but we're not in that person's shoes. And so just letting them speak their thoughts and just being there. Sometimes we don't need to say a lot. So I will advise caregivers, sometimes it's just to sit and let that person vent. So you actually even know what they are thinking in their head. That would be helpful. And reassuring them that we'll be here no matter what. We're all in this together. Because truly, cancer journey is a family journey. It's not a one individual thing. So reassuring that person that they are not alone in this fight, and educating ourselves as caregivers about that individual's health and what their diagnosis, the treatments, what side effects to look out for, and things like that. And then, of course, being there to provide practical support. Sometimes with chemotherapy or some of these treatments, they're worn out, they're fatigued, they can't do even the basic things that they are able to do for themselves. So having someone there to cook, clean, help with running some errands, managing their medication will be helpful. Being patient and flexible. I know that it's not easy. You and I have been in caregiver roles several times over. Sometimes it jars on your nerves and your patience might be a little short. But being conscious of it and trying to be very patient and flexible with that person would be very helpful. And also not forgetting yourself, because oftentimes caregivers just get immersed in the 24/7 care of another, of a loved one. They truly want to take away the pain, take away the suffering of their loved one, and then they forget themselves. And so it's important to remind caregivers to take care of themselves so that they can be in it for the long haul. Because oftentimes caregivers, unfortunately, might get sick or even die before the person that they're caring for. So that's a major one that I will say is, please take care of yourself. And then celebrate.
Like they say on the airplane, put your mask on first.
Your mask on first, yeah. Celebrate their milestones, the achievements. Okay, the tumor has reduced some, make a big deal out of the milestones, because those are memories that person will remember. And then respect boundaries. Sometimes that person doesn't want anybody hovering over them all the time. So allow them space to still be themselves, allow them to be able to make decisions about practical things, their treatments, what they wear, what they eat. If they don't want to eat the same, whatever is cooked, that they're allowed to make that choice and stay positive. Because when people are sick, they don't need the naysayers or the negative person that keeps rehashing all the bad things that could happen. Being positive and hopeful is important.
That's for real, because I remember going through cancer with chemo. It didn't happen so much with radiation. I think radiation kind of just made me tired. But with the chemo, my brain would tell me that I wanted something to eat.
Yeah.
But my taste buds were shot. So by the time you spend all that time preparing it and then you bring it to me, I'm like, oh, I can't eat this.
Yeah.
I remember That's when I wanted a hamburger so badly. And I got the hamburger, but the first bite, I couldn't eat anymore because I was able to taste
Mm.
all the ingredients in the bread as if it was never cooked.
Oh,
Like the
yeah.
baking soda, baking powder, whatever that stuff is, all the salt, everything. So that's definitely there. And a couple other things you said regarding the caregiver. Don't let it show on your face.
Yes. Yes.
Yeah,
Yeah.
don't let it show on your face. I've had to catch myself on a number of occasions where it's like, I was like, no. And the expression is like, oh my goodness, is this crazy or what? But we have to be mindful that even they're going through something. Everybody's going through something.
Yes.
Everybody's trying to get this person from point A to point B as mentally healthy as they can,
Mhm.
right? But in that, we have to play our role of being mindful, deliberately mindful that their mental health is part of their healing.
Exactly. Exactly.
And if we have them fearful of asking for medication, if we have them fearful of even wanting to eat when they need to eat, then that's not helping anybody, right? It's
Yeah.
surely not helping with the goal.
Yes.
And the goal is to get our loved one through this journey.
And the other, as you say that, what comes to mind, we teach students, and I used to teach the beginning nursing students about fundamentals, which cleaning, bathing, all that. Sometimes people are so weak or debilitated that they become incontinent.
Yes.
And then as caregivers, you go and you go, yeah. And
Okay.
that person is already feeling terrible
Right.
about
That you
you
have to be in here. Yeah.
exactly about having you be in here as I take care, as I do this very personal, intimate stuff. And I don't, nobody wants to hear the side comments or the hissing or the facial, like how disgusted you are. So,
Right. And even if we can make fun of some things, not fun as in humorous, but fun as in like we did with little babies,
yes,
right? So like the socks.
yeah,
Sometimes the odor can come through the socks, and they're thinking, oh my goodness, I don't want anybody to be by my feet. But if you realize that that's what it is, then just like you did like with a little baby, like, ooh, you got
yeah,
some sticky feet, but have some soap and water right there
yeah, to clean it
so
up.
that you
Yes.
can clean it up. You can make it fresh. You can talk about you making it fresh for them so that now that settles in their mind. Oh, that I'm getting that I don't even have to sit through and listen and smell this, right? So
Yeah,
when you can make them feel better,
yeah,
that will in their body, it will line up with their mental situation and
exactly.
and contribute to that as well.
Yeah, yeah.
Wow, this is a good conversation.
I'm enjoying it.
Healing for the soul. So, is there a significant access to mental health services for cancer patients within the healthcare system? And what improvements are needed in this regard?
Well, truly, that's always a work in progress. We know generally the mental health providers are not enough for the population that need it. And even so, with the COVID, that actually skyrocketed mental health challenges in the general population as well as in all the specific populations like cancer. We do know that there's a lack of enough mental health access. However, so some of those things is I talked about being holistic, that in cancer treatment, we need to actually recognize that our mental health aspect is critical. And so integrating psychosocial care as part of their wellness profile, like you mentioned, having health systems actually include psychosocial care as part of comprehensive cancer care will be great. Having
What do
more,
you mean by psychosocial? What does that mean?
well, mental, emotional care, having the whole mental, emotional, spiritual care all as part of general cancer treatment. And not just have the medication, the medical model that we have, but also integrating the psychosocial model, the spiritual model, because all of those things culminating to the person, the individual. A lot now has happened around telehealth and telepsychiatry so that patients do not necessarily have to go into an office to be seen. Again, that's because we may have hundreds more psychologists or counselors in a location, but not say in a rural location. So being able to still access the care for them, either by video calls or telephone, it's helpful. It's better than nothing. So one thing that COVID taught all of us is that Zoom is just as well. Virtual visits can be just as well as in person, So telehealth, telepsychiatrists, it will be another good way to integrate if people are not in locations where they have easy access to services. Then providers being culturally competent, recognizing the diversity in their patients is another key, making sure that people are getting that training about different cultures so that we're not just hung up on our heterocentric viewpoints about we are Americans, we know everything, we are better than every other outside group.
Mm-hmm.
So that would be another thing. And then, of course, financial needs, a major issue in cancer treatment. So making sure that the patient also has the financial accessibility so that they can integrate that mental health services. That is, getting the mental health care they need is not limited by their financial situation. And then, of course, including peer support and support groups is helpful because they are then sharing views with other people who have experienced the same thing, who are better able to understand and support them, and maybe give advice. Oh, if you go to this program and that program, that was helpful to me. And then, of course, where people like me come in, the research and innovation, being able to collaborate, get the researchers involved so that we're also looking at what's best, the innovative programming that could be added to that overall comprehensive cancer care.
There was once a patient, and I promise you, I will never forget this patient's comment. We were in a community meeting, and she said, I don't know how come when you're diagnosed with cancer, how come your next appointment is not at the psychiatrist? Just to make sure you're okay.
Yeah.
But we're treated in the healthcare system, we're treated as if we can handle it, and everybody's handling it. And even in my journey, my personal journey, I can remember a year and 15 days later, after being told you have cancer. I've already gone through with 2 sets of chemo, or 10 rounds of chemo. I've already gone through 25 days of radiation. I've already had 2 surgeries. I've already had reconstructive surgery. So after all of that, I turned back and looked at my life, and I realized I was walking in shock for a year. I mean, I was functional. I was doing well. I was happy, not kicking my heels up happy, but I was content.
Yes.
I was still enjoying my life, still doing the best that I could, but I had a shield, a mental shield of protection
Yeah.
that
Yeah.
kept me from the reality of what this could have been while I stayed in the midst
Mm.
of what I had to do.
Yes. Yeah.
So I was fortunate to be one of those. But had somebody actually sat down and talked to me and asked me, how do you really feel? They may have gotten a different answer,
Exactly.
but nobody asked.
That's the thing. The more we think about it, maybe initially, because cancer is so scary to even the providers, that there was just the idea of being very scientific about the treatment, forgetting that we are a whole person and that being whole, there are other aspects of our life that cancer affects or impacts, or that
Right.
also impacts the cancer treatment. So making sure now that mental health is front and center is really critical, because then we are seeing that patients do not just need the tablets or the whatever treatment we're giving them, but they also need someone to talk to about how they are feeling, the fears that they have, the anxiety, the lack of sleep at night, and that person's brain is just running through life, and what could be, is important. So yeah.
Right. And then you were talking about understanding different cultures and backgrounds of individuals and the professionals understanding that. But I also remember having a conversation with someone, and I may have spent about 35, 40 minutes with this person. And in her voice, because I had never seen her, but in her voice, she had a grandmother tone of a voice. And when we finished our conversation, she said, "Baby,"
Oh,
isn't that how your grandmother does it?
yes,
Right? She
yes.
said, "Baby, I have truly enjoyed this conversation with you. But do you have anybody my age I could talk to?" So even within different cultures or within age groups or within different, beliefs or whatever, there's still levels in there of
Yeah,
people that need to have some understanding. And that's why when cancer survivors finish their journey, finish their medical journey, because the journey, you're always on the journey, right?
yeah.
But when you have finished your journey, or even in the midst of it, it's good to lift as you climb. Always have your hand back to help somebody, because somebody needs to hear from you.
Exactly. Yes.
Somebody needs to hear from you. We tend to separate from support groups. We tend to separate from the medical system. We separate from everything. And now, don't get me wrong, for some people, their mental health, it's important that they separate.
Yes. Yes.
But if you know you can handle it, even if it's just one person a year,
Mhm.
or you tell somebody, if you have somebody with these 4 qualities, this age, this kind of cancer, this kind of side effects, if you have somebody with these, feel free to call me. I'll talk to them.
Exactly. And those are critical points. And that makes the point for peer support. We wrote a paper some time ago about, and it was through my church, at a journal through the church. And it was about when blessings don't look like the gift wrapping we wanted to come in, and that's about, you've had this cancer and it was a negative for most of us. But sometimes that's a blessing that God wants you to pass to someone else. And that's what you're talking about, reaching back. So now you've walked that journey. As bad as it was, that experience could be helpful for someone else that's going to go through that journey. And that may be why God found you worthy to go through that process. So I truly cannot speak enough about the critical importance of peer support, that we in the medical arena have recognized that those voices sometimes can speak better or clearer to the patient that's going through it because it seems more authentic. So I could tell whatever to a cancer patient. I've never had cancer. Well, I could speak about my siblings having cancer. But if they hear from you that's alive and breathing and you've walked the journey, it carries more weight sometimes than the intellectual academic words I could say. So it's important to continue to encourage people. We can't force them, but like you say, if they are comfortable to at least participate. And that's why those community organizations like Celebrate Life are very important, because you then provide the avenue for people to be able to participate and to support others in that way.
We spent a bit of time on the word fear.
Mm-hmm.
But you mentioned a whole list of them at the top of our conversation. We mentioned anxiety, depression, sadness, uncertainty, anger. How do we know? And you can pick either one or two of these, but how do we know when we're in those to know we need to get some help?
That's a very good question. I would say the way to know is, for example, I'll take anger. If every time someone says something, whether it's related to cancer or not, enacts or brings up, very bitter response from me, then I'm angry. A friend or a colleague of mine in the past that was diagnosed with cancer, she was so angry with God. If he was truly a fair God, why would he allow this to befall me? So everything centered around that anger that she had. And sometimes it spilled over to her family and friends that were trying to help. So getting that snappy feeling, oh, if you don't want to help me, just go. All of you just go. I can manage myself. That's anger, right? And
Yes.
then the other one is anxiety. Sometimes people have described the feeling that when they try to sleep, there's all that thoughts. Will I wake up? If you lay the wrong way, could I stop breathing? Is this the last day on this? So that anxiety becomes a center piece, and everything then throws that person into that nervous fear, that nervous activity that makes them fearful. So those two, I would say, are very prevalent, and people see that more commonly because those are more easily accessible. Depression, sometimes, what can I say, as Black folks, we don't want to be named depressed. So we may try to isolate from others, just be by myself and not engage the normal things I would usually attend, family gatherings, not being, not wanting or being able to participate in those. Are also ways that you could know that, okay, should I be talking to someone about these things? Because we all have the Spirit of God in us, so we may know that this is not really my usual reaction to things. And having,
I think that's a big one. It's separate from what I'm normally feeling.
exactly.
But if you know people like I know people, there were some people that were really angry before cancer.
Okay,
They
yeah.
were depressed before cancer. They were, totally frustrated, overwhelmed, and stressed out, and all that stuff before cancer.
Mhm.
And to me, this is just me, but if you know that's who you are beforehand, then when you're diagnosed with something as major as cancer, that's a good time
Yeah.
to go and sit down with somebody because you need to process your stuff. Because the cancer, the illness is just being stacked
Mhm.
on top of everything else that you've already experiencing. Because in fact, I was talking to somebody the other day, and they're being evicted from their apartment.
Mhm.
How can you be evicted and you're sick?
Mhm.
Right? It's like, whoa, you think cancer is my biggest concern? I don't even know where I'm gonna lay my head.
They're going to live, yeah.
So there we all had a life.
Mhm.
We all were going through so much even before the diagnosis.
Yes.
But we get that diagnosis, and now it's like, or you get the diagnosis and your spouse wants a divorce.
Mhm.
You get the diagnosis and you find out you're pregnant.
Yeah.
You get the diagnosis and you've got some major situation. You lose your job, or the diagnosis itself is going to cause you to lose a limb or a body part, or whatever. There's so much
There's
that
so
goes to it.
yeah. Yeah. I think actually, like you mentioned earlier, that it will be a good idea as part of that specific survival care plan to include a referral to mental health department for that, for each patient, because some might not need more than that initial intake visit, others may need it upfront and heavy support upfront. Some people may not require it at the beginning, but as the journey progresses, so that at least they've made contact, they have a name to refer to, they have someone to contact in case they change their mind, or family. Another group that could suggest is family and friends, to say, we think it might be important for you to see somebody. And sometimes we're not good about seeing professionals, seeking
Right.
professional help. Some cultures, especially mine, might not might not consider it okay to seek professional help, but just being able to release that, I guess, is a form of stigma, to say that it's okay. It doesn't take anything. It doesn't belittle you. It doesn't make you weaker, a weaker vessel or whatever.
In fact, it can make you stronger.
It can make you stronger. So seek the help as early and as often as necessary.
Wow. Well, this has been a great conversation. It feels like we could have more. We actually break down the different, but I think I want to leave folks with the idea of knowing when you need help.
Yes.
Knowing when your mental wellness becomes a priority,
Mhm.
and you recognize whether it's a professional, whether it's reaching out to a family member, a friend, a pastor, somebody that you can confide in, even if you have to ask them, can we meet 3 times for 30 minutes
Yes.
so I can talk about what I spend time thinking about? So because even as the founder of Celebrate Life Cancer Ministry, when I see a person just kind of glazing over in our conversation, I have to ask the question, what you thinking about? And then let them know that whatever it is, it won't hurt my feelings. It won't make me run,
Yeah.
but I want you to have a safe place that you can actually say something. Because sometimes if we could just get it out of our mind,
Yeah.
we can stop pondering it. It can be processed and moved on.
Yes. Yes. Exactly.
And not under the auspices of get over it.
Mhm.
I'm not saying get over it, because
Yeah,
some things take some time to get through,
yeah.
but to let them know that they have a safe place, because sometimes you don't want to tell your family because you don't want them to be afraid.
Yeah, I don't want to worry them. Yes.
Exactly. So, but to help people get to a place where they know to raise their hand and say, it's me.
Yeah,
I need some help.
yeah,
And no, I don't want to go to this kind of help or this kind of help. Can you refer me somewhere?
yeah.
Right? Or can you be that person?
And two other things that I'm just thinking of as we wrap up. Um, if you can't sleep at night, it's time to seek help. You know, uh, that means that the anxiety is keeping you up at night. And so we may need to figure out why you're not sleeping and things like that. If people are having a sense, and maybe sometimes we don't want to also talk about that. Sometimes people want to end it sooner than God wants to end it because they don't want to go through that journey of pain, and they've seen people and how they look towards the end. That's also time to talk to someone. If that thought ever crosses that person's mind, it's time to reach out and say, I'm thinking about things in this manner. Because truly, it may not be an ultimate thought. It may just be a fleeting thought, but once it has registered, it needs to be rooted out.
Wow. Well, all right, Dr. Ebere. Dr. Ebere Ume. Thank you so much for coming on the podcast today. We have learned a lot. And I just pray that someone is helped, that they can become on the journey of mental healing
Yes.
as a part of our conversation. And to you, our listening audience, we say thank you for joining us. And as usual, choose life.
Thank you.